Tonight, the King 5 investigators expose a trail of damage and heartbreak at the hands of a cosmetic surgeon with a long list of accolades on her resume.
The state of Washington found the Burien doctor violated several state laws meant to protect patients. But as King 5 investigator Susanna Frame reports, the doctor says she's been unfairly singled out, and the patients who complained gave information that's, quote, non-factual and false.
Hello, I'm Dr. Brecht.
Dr. Christina Brecht of Burien, a surgeon who looks to be an industry leader.
I call this a natural breast lift. So let's get started.
Her resume looks impressive. Board trustee for the American Academy of Cosmetic Surgery, speaker and teacher.
Welcome back, everybody. If you're eating
And a frequent guest, not on the news, but on King 5's talk show, New Day Northwest, as a cosmetic surgery expert and paid advertiser.
Here to explain is Dr. Christina Brecht from Aesthetic Rejuvenation.
But behind the scenes, there was trouble brewing. Unbeknownst to King 5 or the public, complaints about Dr. Brecht were rolling in. Since 2017, the Washington Medical Commission logged at least 17 official complaints.
So today we are doing Lipo 360 and a tummy tuck.
2 years ago, as Dr. Brecht continued to feature surgeries on YouTube, the state leveled serious charges against her, several acts of unprofessional conduct, even causing severe harm or death to a human patient.
Was she a risk, in your opinion, to the public?
I'm sure that she was a risk to the public.
Dr. Hakeem Saeed is a board-certified plastic surgeon and clinical associate professor at the University of Washington.
I was shocked and saddened as well that that series of judgments and series of errors could occur.
And she really was just the cutest little thing.
In the case of Shannon Eder of West Seattle, state investigators found several errors. In 2019, Dr. Brecht performed a tummy tuck and liposuction on her, but regulators found she shouldn't have done the invasive surgery in the first place. Shannon was in poor health and a poor risk for the procedure.
6 months before, her primary doctor said she wasn't healthy enough to have this procedure.
Mary Frances Duggan is Shannon's mother.
She just shouldn't have done it. She shouldn't have done the surgery.
The state found Dr. Brecht didn't check on Shannon's health before cutting her open. She didn't perform an adequate physical exam or order appropriate labs. Records show at a follow-up appointment 3 days after the surgery, Shannon had dangerously low oxygen levels, but Dr. Brecht didn't give her oxygen in the office or call 911. That night, Shannon was rushed to the hospital with multiple system organ failure and septic shock. 2 days later, with her family by her side, she was taken off life support. The state found Dr. Brecht's failures ultimately led to her death.
It was just unbelievable. It truly was. How could this have gone so wrong?
Dr. Brecht declined an interview, but she told state investigators that Shannon wasn't honest about her chronic health problems and that if she would have told the truth, she wouldn't have done the surgery. She also told the state that, quote, "At no time do I believe I put any patients at risk," and that none of the patients in the state's case suffered injuries as a result of my care and treatment.
And it goes into that container.
It wasn't just Shannon. The state sanctioned Dr. Brecht in 9 different patient cases, referred to in state documents as patients A through I. In 4 cases, the state found violations for her anesthesia tactics. Instead of using general anesthesia or IV sedation, she relied on pills like oxycodone and lorazepam.
And then also this gluteal cleft area here.
Even for high-risk surgeries, with no anesthesiologist in the room.
Arm lifts, tummy tucks, breast lifts, everything. I mean, it's everything.
On the phone, Dr. Brecht told me she stands by her anesthesia protocols. On New Day Northwest, she touted the safety of them.
It also helps decrease bleeding, so I don't need those dangly drains after surgery. And it also helps with post-surgery comfort.
The risks are potentially fatal on the table. It's a little bit like boxing with one arm behind your back. If you can only give oral medications, you literally cannot respond to any of the acute things that could happen.
Instead of an anesthesiologist or RN, the state found in at least one surgical case, the doctor was assisted by a nursing aide licensed in South Carolina and a medical assistant with an expired license. The King 5 investigators have found the doctor's facility here in Burien has licensing problems as well. 4 months ago, the state issued her a cease and desist order for performing surgeries in an unlicensed surgery center.
I wanted her to lose her license. I mean, I make no bones about that. I felt that that she should never, ever deal with patients again.
That's not what happened. Dr. Brecht is still practicing medicine. She's on a 3-year probation with restrictions, but after retraining, she can petition to get most of her privileges back.
Then she can go back to living her life. Well, the other people who have been affected by this, that's not going to happen to them. Shannon's not living her life.
Was justice served on behalf of your daughter, Shannon?
In my opinion, no. We found a place that we could see it all the time.
In the parents' backyard, a tree dedicated to Shannon is inscribed generous, kind, thoughtful, the way they're remembering their daughter, who is also a devoted sister and aunt.
Every holiday is horrible. I mean, we get through it and we try to do the best we can. And the kids' graduations, the nieces and nephews, all that stuff she missed. It's just really, really hard to think that she's not here because of this.
And this may surprise you, but Dr. Brecht is not a board-certified plastic surgeon. She's a family practice doctor, but in the state of Washington, that's allowed.